First of all, thank you for your work. I agree with my colleagues about we should not cut your budget. First of all, I want to just say, and I'm sure you would agree with this, you said that this virus is expansive in Italy and South Korea, now in this country. It is absolutely wrong and inappropriate to call this the Chinese coronavirus. I assume you would agree with that. Yes, China was the first phase. Korea and Iran was the second phase, with Italy, now all of Europe. I mean, just if you looked at even just last night, I think if you have a second, just over the last 24 hours, there was almost 1,500 new cases in Italy, right. 1,300 in Germany. Okay, but thank you. You answered the question. Thank you. There's been some other real misleading statements that are wrong. I'm going to read some. If you agree with these statements, just let me know. Our tests have been perfect, that this is like the coronavirus, like the regular flu, that it's a hoax, that anyone who wants to be tested can be tested, that the number of cases will be soon be down to 0, they'll magically disappear, you can still go to work, and it's okay to shake hands. This would be misleading. Since I'm not hearing anyone want to correct that, I'm assuming that you would agree that those are misleading statements. I don't think I heard any that I would say is not, other than that I do believe that availability of testing in the last 2 days through Quest and LabCorp is finally getting us where we need to be. Thank you. You know, there was a new, I just want to ask you, are you familiar with the public charge rule, the new public charge rule? Yes, I am. I think there's I'm concerned that it might lead people not to go to get the care they need. Could you respond to that? I would concur with you. I've talked to some of your colleagues when we were on the trip in the state of Washington. They brought this, and we are looking at it to see its public health implications. Okay, thank you very much. So would you say we were at the beginning, the middle, or the end of this coronavirus fight in the United States? I would say I can't predict. Okay. Can you say what percentage of Americans you think you are predicting will get the coronavirus? I think it depends how effective our public health response is right now. I do want to state one thing. We all have a role to play. And it's really serious when we say to practice, you know, the washing of the hands, coughing in your elbow, you know, try not to touch your face. I know they're going to count how many times I did on this, but it's very hard, but you got to try not to. And then I think, you know, if you're sick, stay home. Please stay home. All right. Okay, well, did any health agency recommend to the White House that people over 60 should not fly on planes? I don't know the exact age. I'll get back to you, but we have recommended that the elderly and vulnerable, including children with chemotherapy and others, should really reconsider at this point travel. And what is the age of elderly? Because many of us leave the room. I didn't define it, but I will tell you that in the discussions we had, the individual brought it up did say it was a year older than they were. What is that age? Right now, we've been looking at the data. We've been looking at really, if you look at the data, you know, the average age in Italy of death is like 82, 83, 84 years of age. It's really the data that Ambassador Birx has gotten from China, Italy, Korea, and our own nation. Looks like 65 and above is where most of the people are that are dying. All right. One of the concerns I know we have is, especially in these nursing homes where everybody's getting sick, including the care providers, what is the level of your concern about us having enough care providers to take care of people as this disease spreads? Yeah, this is the important of what we've talked about before, being over-prepared. If you're over-prepared, the ability to protect the healthcare professionals, and not just the healthcare professionals. I think the Congresswoman knows that in Washington, one of the places they don't have firefighters. Their firefighters are all in quarantine, self-isolation. So we have to be over-prepared to respond to these outbreaks, not try to catch up. Time matters in infectious disease. We have more time in environmental disasters like hurricanes and flooding, you know, than we do when it comes to an infectious disease. Infectious disease, if you're a week late, as some of you have criticized about the testing or whatever, it matters. So let me, I'm running out of time. We have another round coming? Okay, one more question on this round. So I have some friends or people who are self-quarantining themselves. We've read about it in the paper and so forth. So you get exposed, you self-quarantine for 14 days. Is that right? Is that because you can have is that how long you have the disease for, 14 days?
Yeah, right now the average incubation period from infection to symptoms is 5.2 days.
Okay, but how long does the disease last once you get it?
Well, it varies if you do get it, but if you get exposed, you will develop symptoms within those 14 days and be able to then either be diagnosed. If you stay asymptomatic, we have no evidence that you still shed virus longer than that.
But if you self-quarantine for 14 days, you come to work, and then you meet somebody who else, and you get exposed again, then you might have to self-quarantine yourself again, which means that we may all be in a process of self-quarantining.
You sound like what my wife said this morning, okay? We fully intend, I do believe, if we're all in this together, from individual citizens all the way up, we have a great public health department. We still want to stay with our early diagnosis, public health isolation, and then aggressive use of mitigation strategies. You know, we're in a fight to to basically stop this outbreak, at least for now. Many of us are hoping, not knowing, hoping that this will follow the pattern of flu and other respiratory viruses. That means the transmissibility in our environment might change. It is interesting that when I look at the cases around the world and I censor out all the export cases and I censor out all of the contacts of exports, and you look in the Southern Hemisphere, there's very few cases in the Southern Hemisphere right now. It's a great possibility that might change, just like as flu changes. So I think we need to stay the course, be aggressive. This is, again, why I think being over-prepared is where the posture we want to be in. This is why the supplemental you did in such a fast way, on a bipartisan way, is so important to us, because it gave us resources now to scale up.
Frankel. Thank you again for being here. You would agree that this is not a time to cut any of our global health budget?
As I said, I think one of the most important things we need to do is to build a robust long-term foundation of global health. I think CDC is the tip of the spear, and I think this is a time to get that foundation built. All
right, so the answer is yes, we should not cut, or no, we shouldn't cut, or yes, answer is yes, we shouldn't cut the global health budget. Are there enough, I don't know if I'm going to ask this, but are there enough masks now for our first responders and our healthcare workers? And if not, where do we get them?
We can, again, this is something that ASPR is in charge of, looking through and making those calculations. So we can get back to you, but I refer that to ASPR.
So I have a couple practical questions. So I have an older, my mom's actually older than me. That's obvious. Okay. She's healthy, knock on wood. She was supposed to go to the doctor for a checkup. Now she says she's afraid. She says, I'm not going to go for a checkup. There could be a room of sick people. There are, of course, it's a room of sick people. What do you say to that?
I think your mother has a lot of wisdom.
Okay.
Okay.
I always thought that. Okay.
Unless she really has a requirement to do things right now, we are trying to get the elderly and vulnerable to kind of just step back and try to avoid being in crowded places, avoid travel. This is where we are right now.
Okay, got it. Another practical question. So we're told to wash our hands, all that, don't touch our face. People are coming in contact, even ourselves, with our clothing, with our furniture, and all that. Is it spread that way?
Congresswoman, that's a very important question. This virus clearly can live in the environmental services for some period of time. With the ship in Japan, very aggressive studies are being done to see how much virus they find on railings in different places. Finding the virus doesn't mean it's infectious, but we can detect this virus for prolonged periods of time in surfaces, and the role that we call fomite transmission is still unknown. That's why it's important when you put your hand on the handrail as you're walking down, you probably need to wash your hands afterwards. You don't think about it.
What about if you touch the handrail and then you touch your clothing, but you can wash your hands, but you can't wash your clothing?
It's probably more touching the rail and putting your hand to your face.
Okay. All right. So is the information coming from the World Health Organization reliable?
I would continue to say the World Health Organization is a very well-respected public health organization.
So, as right now, can anyone go to the doctor and get tested for coronavirus, or we still have a delay in having enough tests for that?
As of let's see, well, I don't even remember what today is. Today, Monday? Yeah, Tuesday. Okay. As of Monday, Quest Labs and LabCorp Labs have made this test available. They have in doctors' offices. Like when you go to the doctor and you get your blood drawn, the test isn't done there. It's done by LabCorp or Quest. And now that same thing can happen if your doctor wants to order a coronavirus test. And
I want to just go back to, this is another common sense question, though. It seems to me that some of the reasons, I mean, not shaking hands, washing hands, self-quarantining is not just about not getting the coronavirus. Well, it is about that, but the fact is we don't want everyone to get it at the same time because we can't take the stress on the healthcare system or the stress on the economy. Is that right?
Yes, and we don't want them to get it at the same time they're getting flu. This is unfortunately, this virus is very similar in sense it's a respiratory virus. So, if you look at hospital capacity right now, much of it is full, up to 95, 96, 97%. So we really don't have a lot of resilience in the capacity of our health system.
Are there test shortages as any other part of the world? Do we know? Are there test shortages in any other part of the world?
I don't know exactly, but I can tell you, obviously in areas like sub-Saharan Africa where they have really underdeveloped health systems, clearly they've been spared right now. The reason for that is unclear. If it is seasonal, obviously we're going to have some challenges. And more importantly, the most important, you asked me medical interventions before. The one medical intervention you need if you go into the hospital is oxygen. And there's many health systems that don't have the capacity to deliver oxygen to its people.
Is that in this country?
Not in our countries.
But in other countries?
Yeah.
Okay. Thank you. I yield back.